Hello. Today we are doing a role play for Station 5, brief clinical consultation for the MRCP PACES examination. Hello.
Hi.
My name is Dr. Punekar. I'm the examiner for today. Are you Dr. Agarwal?
Yes, I am.
Okay. So this is Station 5, brief clinical consultation. You get 10 minutes altogether. Of that, you get 8 minutes with the patient, and I'll give you a warning when 2 minutes are left. And you have 2 minutes at the end with the examiner. Yeah, making it 10 minutes altogether. Miss Kirsty Layton is a 25-year-old patient who has been referred to the medical clinic. She has had pins and needles in her feet. She has been a diabetic since age 8. Please conduct a brief clinical consultation, a focused examination, and then discuss your management plan with her.
Hello. Hi.
Hey.
Is it Kirsty Layton?
It is.
Hi. My name's Sunil Agarwal. I'm one of the doctors who's working here. I've just come to see you, if that's okay.
Yeah, no problem.
Can I just confirm what's your date of birth and your address?
7th of July 1992. I live on Sharrow Green Lane in Preston.
And that makes you 25 years old?
That's right, yeah.
Okay. So what is it that brings you to see us today?
I've just started to notice some kind of pins and needles in my feet.
Okay.
And kind of some numbness.
Right.
I have been a diabetic for a long time.
Okay.
That's all my kind of history.
Right. What I'd like to do is just ask you a few questions about your symptoms.
Yeah.
Then I'll go on to ask a bit about your diabetes and any other medical conditions you might have.
Okay.
So you say it was mainly numbness and pins and needles.
Mm.
Can you tell me whereabouts is it on your feet? Is it your foot or your legs or your knees where you're getting these feelings?
Mainly like in this part of my foot.
Okay, so the lower part. And is it both feet or one side?
Both feet.
Both of them. And when did you first notice this?
Maybe the last few weeks.
The last few weeks, okay. And is it painful at all?
No.
Not painful, just numbness and tingling. And is there a time of the day when it seems to be worse?
No, it just seems
there
to
all
be
the
all
time?
there.
Doesn't wake you up at night time?
No,
And you don't find it's affecting things like your walking or anything like that?
no.
Okay. And do you feel any weakness in your legs at all or any other part of your body?
No.
Okay. I'd like to just ask a few questions about your diabetes, if that's all right. Before I start, do you have any other medical conditions?
No.
Just okay. And you said you've had diabetes since the age of 8.
That's right, yeah.
Is that type 1 diabetes?
Yeah.
How is that controlled? How are you finding that at the moment?
Well, I normally I'm on kind of Act Rapid and
Okay.
Lantus.
Right.
So yeah, sometimes I'm a university lecturer,
Right,
so
okay.
life is very busy. So I
Okay.
don't always. I'm kind of on the go. Sometimes skip meals.
Right.
Sometimes miss my insulins.
Right.
So my sugars can sometimes be really high, sometimes really
Right.
low.
Right.
And
How often do you measure your sugars, do you say? Would you do them at least every day or sometimes less than that? Or?
well, I try to do it at the meal time, and
Okay.
then I'll give my insulin accordingly.
Right. And you said sometimes they're high and sometimes they're low. How high have they gone in the past, say, few weeks?
Like up to 30.
Right. And what's the lowest they've been in the past few weeks?
2.
2. And have you ever needed to go to hospital because of issues with your diabetes in the past year or so?
Yeah, I had an admission last year, quite a few admissions with DKA.
Right. Okay. And you said that your insulin. You said you have the Act Rapid, and then you also have, what was the long-acting insulin you said you use?
Lantus.
Lantus. And how often do you find you're skipping having insulin?
It's really hard to say. My life's just very busy, and it's just not really a priority, really.
Right.
But with these symptoms, I'm starting to realise that it might actually be something I need to address.
Okay. And what are the reasons why you seem to be missing your insulin?
Well, just with the amount of lectures I've got on,
Right.
long hours,
Okay.
I just sometimes forget and I just
Right,
kind of skip.
right. The next thing I want to ask about maybe some other symptoms that people can get with diabetes. Have you had any problems with your vision at all?
No, not that I've noticed.
And do you have regular eye tests at all with the
Yeah, I
diabetes?
have my annual checkup.
Right. And when was the last one that you had?
last July.
Okay. And have you ever noticed that when you stand up you get dizzy or lightheaded at all?
No.
No. And have you ever had, or has anyone told you have any kidney problems at all or anything like that? No. Okay. Right. What I'd like to do now is just examine you, just examine your legs, and then we'll have a chat about what I think could be going on and what we can do to help you. Is that okay?
Yeah. Great.
Okay, Kirsty, what I'd like to do is just examine some of the nerves that go down your legs. Is that okay with you?
Yeah.
So the first thing I'd like to do is just with this cotton wool, bud. Can you feel this?
Yeah.
Can you feel it soft?
Yeah.
I want you to close your eyes and say yes when you feel me touching you on your legs. Can you feel anything?
Yeah. 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 Yeah.
Okay, thank you. And same thing again. You can open your eyes if you want, just with this. Don't worry, it's a bit sharp, but it doesn't break your skin. Does that feel sharp?
Yeah.
And it feels sharp. Okay. So again, if you close your eyes and say yes if it feels sharp, and no if it doesn't feel sharp, or if you don't feel anything. Okay?
No.
Is it sharp?
No.
Can you feel it?
Slightly.
But not sharp.
No. Yeah.
Does it feel sharp?
Yeah. Yes.
Does it feel sharp?
Yeah.
So again, say yes if it feels sharp, no if it doesn't feel sharp.
I can feel it, but it doesn't feel sharp.
Okay.
Yeah, I can feel that.
Does it feel sharp?
Yeah.
Does it feel sharp?
Yes.
Does it feel sharp there?
Yeah.
Okay. And then, again, can you feel that this is it vibrating?
Yeah.
So again, I want you to say, you keep your eyes open for this. Can you feel this?
No.
Let's try again. Can you feel this?
No.
Can you feel this?
No.
Can you feel this?
Yeah.
Is it vibrating?
Yeah.
And same on this side. Can you feel this?
No.
And here?
No.
And here?
No.
And how about here?
Yeah.
Is it vibrating like on your chest?
Yeah.
And then finally, you can keep your eye open this. I'm going to move your big toe either up or down, okay? I want you to tell me which way you think I move it. Just open, and if you close your eyes for me.
Up. Down. Up. Up.
Okay, and let's just try on the other toe. So again, you can open your eyes, and I'm going to move your big toe either up or down. And tell me which way you think I move it. And close your eyes. So,
Up. Up. Up.
okay, you can open your eyes now. I'm going to test your reflexes now, and just keep your legs nice and relaxed for me, if that's okay. Nice and relaxed. Don't move them for me, keep them nice and relaxed. That's it. So, nice and relaxed. Don't move them for me, nice and relaxed. Okay. Just move your leg to the side. Just bend your knee for me if you can, and let it flop to the side. And again, nice and relaxed. Okay. This side. Your leg flop to the side and keep it nice and relaxed for me. Okay. So I've just examined you and I have an idea of what could be causing your symptoms. Before I start discussing that and what I think we need to do, is there any particular concerns or questions you have for me?
So my main concern is this you know, these feelings in my feet, and you know, if they're going to get worse, or how I manage that. Really.
Okay, so we'll have a bit of a talk about that now. Now, I think the problems you're having in your legs is related to your diabetes. There's some more blood tests I'd like to do to look into that, but it's most probably because of your diabetes. If someone's had diabetes for a long time, and especially if it's not as well controlled as we'd like it to be, it can affect the nerves. It can give you problems with sensation in your nerves. The concern is if this does progress, and again, as I say, we'll talk about things we can do to prevent this happening, is that it can affect your the movement in your legs. It can make your legs feel weaker, and sometimes people can get things like ulcers in their legs. But as I said, I don't want to say that to scare you. It's mainly because it's the way we manage this is try and prevent that happening by trying to make your diabetic control better. Because that's the main way we manage this, is to try and find out ways to try and make your diabetic control more better. Is there anything you can think of, or how we could maybe help your diabetic control, or anything that you...
Yeah, I mean, I recognise my insulin, and you know, I've sometimes skipped doses or I've missed meals. I have had the education in the past about the importance of regular meals and taking my insulin, but my lifestyle up until now is just not allowed that. But I think I need to be a bit better really at following.
Can be tricky. One thing I'd like to do, and again, you seem like a very educated person, and you were saying that you know how to carb count and count how much insulin you need, but I think if we were to get a diabetic dietitian to come and speak to you, they might be able to give you a bit more information of some things you've not considered. Also, there are diabetic specialist nurses in the community. Have you seen the diabetic specialist nurses? Are you in contact with them?
Yeah, I mean, I see them at least annually, if not, if I've got problems in between.
So it might be useful now, because of these issues you're getting with your legs, for you to maybe go and see them, for them to maybe discuss with you if there's any changes we can make to your insulin regime, or maybe give you some advice about managing your diabetes with your busy lifestyle. Another option is an insulin pump. Sometimes people can have a pump that they wear all the time, and that slowly injects insulin into their body, and you give short doses of the insulin when you have a meal. People who have maybe quite hectic lifestyles, that can sometimes give better control, only sometimes, but again, that's something to consider and something you could discuss with the diabetic nurses.
Okay.
Do you have any questions for me?
I've heard of the pump, but I would like to know more. But I recognise I need to improve things from my side as well to be able to have that.
Time. You've taken her history, you've examined the patient, and you've spoken to her. Would you like to tell me what were the main issues that you've identified here? Firstly, would you like to tell me what is your top diagnosis?
So my main diagnosis would be a peripheral neuropathy secondary to diabetes.
Okay, that's good. Would you like to tell me what issues you've identified in her management of diabetes?
So the main issues is that because of a busy lifestyle, that she is a lecturer, and her meals are quite irregular. She sometimes had missed dose of insulin on quite a number of occasions, and that's led to quite poorly controlled diabetes. Her blood sugar measurements can be quite erratic.
Right, okay. Do you think even before she became a lecturer, she may not have been such a good sort of a patient with her control of diabetes?
We didn't ask about previous control of diabetes, but one thing I'd like to do is ask more about if she understands how to carb count, and she understands how to decide how much insulin she should be giving.
Okay, well, that is what I was going to come to. How would you approach this issue now? So how are you going to help her control her diabetes better?
So one thing is to make sure she understands that the complications she's getting most probably a side effect of her diabetes, and that's the poor control of her diabetes probably causing this and may make it worse. Second thing is to try and find out from the patient's lifestyle ways that you can maybe try to help control. It could be suggested to use an alternate type of insulin therapy, such as insulin pumps, the continuous subcutaneous insulin devices.
Right. Does an insulin pump have any particular advantage in this patient?
So insulin pumps, people have to be quite educated and understand how much, to be able to carb count to decide how much insulin they would need for whatever they've eaten. However, for someone who has quite an erratic lifestyle, where their meals may be quite variable throughout the day, they may give better control. The insulin pump does have some downsides to it, but for people with erratic lifestyles that may be beneficial.
Okay. Do you think the patient is now coming to realize that she needs to take better control of her condition?
Yes, I think that with the information I've given her, and hopefully with the information other people will give her, she'll understand that these complications are related to poorly controlled diabetes, and there are other complications that could develop because of the poor control
Okay.
as well.
Do you, let's just come to her neuropathy now. How long do you think it takes for a diabetic to develop neuropathy?
I'm not sure, but it's likely that this lady will have had neuropathy for a long, she's only noticed the symptoms in the past few weeks, but she would likely have had the neuropathy for a long time before that. It's only now she's actually recognised symptoms.
Okay. Okay. Good. Thank you.